Thank you. I'm not going to take a lot of time because I know it's been a good and long 2 days, and also because I know the weather is outside continuing to have snow come down. But I do want to make a couple comments. I want to again thank each of the panelists for their participation and their contribution in each of the individual sessions and throughout the workshop discussions. I also want to extend appreciation to all of you here who have attended, those who attended yesterday as well as today, for pushing our thinking and our deliberations. And equally important, I want to thank my colleagues who have helped to organize and support this workshop, especially my co-chair, Dr. Piantadosi, and to Cheryl Nass and the others from the Academy who have organized this event and provided us this opportunity. So thanks to all. Again, I'm only going to take a couple minutes. I want to just highlight a couple of the themes that we have heard throughout yesterday and today. The hope here is that we can sustain discussion of these issues and ultimately to potentially change the system and really to inspire others and to be agents of change. So the first is public trust, and combined with that risk. And these are themes that we heard a lot yesterday. Yesterday we began with a lot on public trust, and we heard it throughout the morning session. We also have heard a lot about risk throughout all of the sessions. And ultimately, to change the system, we have to inspire others, again, to understand that there's risk in everything that we do, but we cannot be so risk adverse that we cripple the system and that we don't promote the advance of cancer research. A regulatory structure that's based on legalistic fears of rare events that may not benefit the mission to prevent and cure cancer. It will not help our patients, which is what we heard yesterday from our advocates. So we need to encourage a culture change of risk-based oversight. It's been a recurring theme throughout the workshop. This may be less focused on traditional models of informed consent. We may need to consider innovative ways to approach informed consent. We've heard a lot about transparency and engagement throughout the workshop. As we've heard from our patients and advocates, they are concerned about what we don't do with the gifts and resources that they provide. And the information on other rare risks, more so than the information on other rare risks that we sometimes outline in multi-page consents. So this is not to say that there are no risks, because certainly we've heard and spent more time today thinking about studies where there are appreciable risks, but we should be considering these risks from their varied forms from low to high. A second recurrent theme is process, and we heard a lot about this yesterday and a lot, probably even more so today. Our patients and many speakers have highlighted that we need to remain focused on the process and not simply in forms and regulations. While we can make some progress through changing consent forms, we need to think more about our process of informed consent, more ways of innovating this process. Our process for making decisions about data sharing, our process for considering offering return of primary and secondary individual research results, our process for defining research activities, which we discussed more today, and the oversight of various trial designs and learning the promise of learning healthcare systems. And it became clear today that there are multi-level issues, that this is not just at the government regulation level, but also at the institutional level. So there is really going to have to be what I think yesterday were comments about parallel change efforts that happen at each of these levels. And the last is progress. And well, this is probably the hardest of all. And this workshop was not designed necessarily to make that leap, but rather to discuss and organize the issues. There are additional forums that focus on direct action and developing action points. Regardless, the progress does start here, and we can and must all be the agents of change. There are so many questions. That was very clear today, which will be outlined in the workshop product. We have heard many opportunities throughout the workshop, including continuing individual and involvement in what feels like perhaps the slow and futile ANPRM process. Continuing to persistently push the agenda at all levels and in parallel efforts at the regulatory, institutional, and individual encounter level. And one of the comments that I heard yesterday and really appreciated was, we heard I do what my mentors do. So your examples at an individual level do not go unnoticed, and over time, it can instill the culture change that I think we have all been aspiring to. So as you are aware, there will be a workshop report which will summarize the panel presentations and discussions. We also intend to prepare a companion manuscript for a peer-reviewed journal with the hopes that this will disseminate the message and engage our colleagues and leaders to look critically at the entire enterprise overseeing human research. And with that, I want to say thank you for being here. Please have safe travels home. Thanks so much.